I love visitors. Hi, what's your name?
Mary Lynn Coble.
And you're a doc
I am. I'm an OBGYN at Virginia Physicians for Women.
at Innsbrook.
Yes.
And I love that Innsbrook location. It's so easy to get to.
Yes, lots of our patients love the Innsbrook location, although we have several different locations. But Innsbrook is convenient for a lot of people who work in that area. It's not linked to a hospital, so parking is really easy. And we can guarantee you that your doctor will not rush out to deliver a baby while you're waiting to see them.
Well, and I think it's just so great that you have such flexible hours. People who are working and so busy can come virtually anytime.
Yes, we have lots of patients who just run over during work. They're in and out quickly, 30 minutes, run back to work, and haven't really, altered their schedule that day.
Beautiful location, too.
Yes, very nice office.
Now, it's very important with Breast Cancer Awareness Month to talk about the importance of having those mammograms. What age do you suggest?
Absolutely. Most of the guidelines suggest starting mammograms at age 40. And each year after that, certain women who are at higher risk should discuss with their physicians whether they should start earlier.
Okay. And it's not anything to be afraid of. I mean, most insurance covers that.
Most insurance covers it. Certainly if it's a routine recommended screening, your insurance should cover it. And it's also not that unpleasant to have done either.
Exactly. And it's very important to know if you have breast cancer because that's one of the most treatable, at least it seems like.
Absolutely. It is a common cancer among women, but it is very treatable if detected early. And that's the great thing about mammograms is it's a fairly painless way to detect breast cancer and intervene before it becomes life-threatening.
So when a patient comes to see you guys, you're able to tell them what they need to know if they do need to see somebody else, and they can come back and speak with you.
Absolutely. Any of our physicians can discuss the guidelines, who should have screening and when, and we do offer mammography for screening purposes at our Innsbrook office. Any diagnostic mammograms we refer to the hospital location. But just your annual screening mammogram you can have at your Innsbrook location when you come in for your annual exam.
That's perfect. And also something that's so important about Virginia Physicians for Women, you get to really choose your doctor, and you all spend time with your patient. You answer questions.
We do. We try our best to spend time addressing all the issues each of our patient has that day. And we really strive to offer really individualized care for each of our patients. We have a lot of physicians to choose from at a number of different offices. Our website has a profile of each of us and which offices we practice at, and a lot of patients come in and tell me that they found my profile on our website and something about my interests or my background made them feel a little bit of a bond to me, and that's how they chose me as a physician.
Well, you don't seem scary at all, so that's good.
Thank you.
Well, one final word. What would you say to ladies out there who haven't had their mammograms?
Do it. Lots of patients tell me that they're scared. I don't know if it's because they're scared of discomfort or just scared that the mammogram will detect something that they don't want to know. But it's much better to detect it early. And I've had a number of patients with an early detection, and they had a surgery and maybe some other treatment, and they're fine. Years later, they're fine. So early detection really is the key to survival.
All right, thank you. Virginia Physicians for Women, Innsbrook.
Thanks for having me.